Hello, my name is Meghan Szmyt, and today I'll be sharing with you the International Review Board study proposal for the comparative vitamin B12 supplementation methods for patients with megaloblastic macrocytic anemia. First, a bit of background about vitamin B12. It's a water-soluble vitamin, meaning that it gets absorbed into the bloodstream. It exists in some food sources naturally and some fortified food sources. So as you can see a table on this slide explaining some of the natural food sources that vitamin B12 exists in. So seafood, meat, and dairy products as well. The recommended daily allowances for vitamin B12 are 2.4 micrograms per day. Of course, this increases for women who are pregnant or breastfeeding. There is no upper limit of vitamin B12 set, since there's no toxic effects that have been seen with excessive vitamin B12 intake. Vitamin B12 deficiency, though, is pretty common. Some of the causes would be inadequate intake, so vegans and vegetarians are suggested to take a B12 supplement. GI resection or bariatric surgery, as well as impaired intestinal function, can cause B12 deficiency. The stages of B12 deficiency start off with low serum B12 levels, then going into low cellular levels of B12 and decreased DNA synthesis, resulting in hematological changes within the blood, which ends up causing megaloblastic macrocytic anemia. Symptoms include fatigue, as well as hematological changes and neurological function. B12 is released from food into the stomach with the help of pepsin. It then goes on to bind with R proteins, forming the B12R complex. It is then released from the R protein in the duodenum. The B12IF complex is formed when B12 binds with intrinsic factor. And then this complex binds to receptor sites within the ileum. Endocytosis takes place, and then B12 is stored within the liver. It's essential for red blood cell formation, neurological function, as well as DNA synthesis. A bit about megaloblastic macrocytic anemia. Macrocytic means abnormally large, and megaloblast refers to immature red blood cells. So the definition would be a circulation into blood, immature, abnormally large red blood cells. And you can see in this figure that the megaloblastic anemia cells are significantly larger than normal red blood cells. Causes would be vitamin B12 deficiency as well as folate deficiency. Our research question is, what is the best method of B12 supplementation for people with megaloblastic macrocytic anemia? The purpose of this study is to determine which method of supplementation is best for treatment. Our hypothesis is that the oral crystalline B12 supplement will prove superior to the other B12 supplements studied. And the null hypothesis is that there will be no relationship between vitamin B12 supplementation and the treatment of megaloblastic macrocytic anemia. While there's existing research on vitamin B12 deficiency and supplementation, as well as megaloblastic macrocytic anemia, there really is a lack of research that links the two. So there isn't much discovery about which types of supplements work best, and that proves that this study would be quite beneficial. So this study will be longitudinal panel design, meaning that the same data will be collected by the same subjects over a period of time. The G-power test was used to determine that the ideal sample size for this study would be 280 subjects. It is a randomized controlled trial, meaning that of these 280 subjects, they will be randomly divided into four treatment groups. Our first group is the control group, where subjects will be receiving 1 milligram of an oral placebo. The second group, the subjects will be receiving 1 milligram of the traditional B12 oral supplement. Then the third group, patients will be receiving 1 milligram of the crystalline B12 oral supplement. And finally, our fourth group, subjects will be receiving 1 milligram of sublingual B12, which is administered under the tongue. Subjects will be recruited across the United States, divided into 4 regions, so the Northeast, the South, the Midwest, and the West. There will be study sites located in all 4 of these regions. There is an extensive inclusion and exclusion criteria for this study, some of which would be subjects must be between the ages of 20 and 49. Women who are pregnant or breastfeeding may not be participating in this study. All subjects must fill out an informed consent form so that they are educated on what will be going on within the study and they are aware of their risks and their rights. All identifying data will be kept confidential and all subjects will be assigned an identification number. This study is designed to minimize risks and maximize the benefits. So, like I said, with the exclusion criteria, another example would be any subjects who have Leber's disease will be excluded from the trial because it has been shown that people with Leber's disease, if taking a crystalline B12 supplement, they may have issues with their visual impairment and possibly leading to blindness. So we'd like to minimize any risks of something like that. Benefits, we do have 3 groups that will be receiving vitamin B12 supplementation. So the benefit would be increased B12 levels as well as treatment of their megaloblastic macrocytic anemia. Research setting, all of the dosages will be done in a either hospital or clinical setting, meeting with medical professionals at all of these study sites. So this study is a quantitative study design, meaning that it will be collecting quantitative data. Data includes demographic, which would be date of birth, sex, geographic region, but nothing like name or address or any of those identifying data points. Medical history and concomitant medications are important. Any person who currently has an infection or is taking a medication that may cause B12 deficiency, such as a proton pump inhibitor or an H2 blocker, will be excluded from this study. And then finally, and most importantly, the laboratory tests, which will include a fasting blood and a urine test. In the table on this slide, you'll be able to see all of the tests that will be run through these laboratory examinations. All data will be reported by site professionals and will be collected in a confidential medical database. So for this study, we'll be using the Oracle Clinical Remote Data Capture, or RDC. Statistical analysis software, or SAS, will be used to perform all of the statistics tests for the study, including the one-way ANOVA to test the difference between the means of all 4 of these groups for one or more variable. Our expected results are that the 3 B12 treatment groups will improve their B12 serum levels as well as their macrocytic megaloblastic anemia parameters. It's not expected that the placebo group will have any changes to their B12 levels. So this study is quite important because there are no other studies of this nature that examine the vitamin B12 treatment options for patients with megaloblastic macrocytic anemia. There is a lot of avenues for further research after this study is performed, such as examining subjects of different age groups. While this study is looking at subjects ages 20 to 49, it would be really important to look at patients that are younger, but especially patients that are older. Individuals that are 50 years or older are suggested to take even more B12 supplements because their absorption has decreased with age. It would be interesting to look at other geographic areas, so either a specific area within the United States or other countries across the world. And these are only 3 methods of B12 supplementation. There's intramuscular B12 supplements, as well as chewable tablets, nasal sprays. So looking at other methods of supplementation will really be beneficial because there are so many options. Thank you so much for joining me on this presentation. If you have any questions or comments, please leave those down below, and we will see you next time. Thank you.